Dr. Mark Olfert, coming from West Virginia University School of Medicine, and he's going to speak to us about physiological angiogenesis, insights from exercise and detraining, with another beautiful picture of capillaries and skeletal muscle.
Muscles, muscles, muscles. Well, Tara, thank you so much, and to the organizers for putting on the symposium and the meeting here. It's been really fun to hear some of the talks and learn some new information. So I'm actually not going to talk very much about training. Ellen and Emily have done a great job setting the stage for me. So you'll only have 2 data slides where I'll show you some of the training responses because, in fact, I think I've learned as much about angiogenesis from detraining and the studies that we've done. And this is what I want to show you and give you some of the insights that we've learned there to understand some of the actors and how they respond. And some of them don't actually behave in a way that we might actually predict. And so, first, as it's been said with at least a couple of speakers before me, physiologic angiogenesis is something that once you're an adult rarely occurs. There's only really a few conditions outside of growth and development, and one is menses in women, and then the other is with exercise in skeletal muscle. Outside of that, you really only have angiogenesis in the context of injury, such as wound healing, maybe environmental stress. These aren't sort of necessarily everyday things that we occur, and then pathological cases. And I'm not going to talk about that, but the reason we got into studying the detraining responses was because of its potential connection to pathologic responses. So I will come back with one slide at the very end for a clinical implication there. And so really, when we talk about angiogenesis, it's the expansion from a normal base that we're at. So as an adult, we have an established network, and that can grow. When we lose vessels from a disease-related point of view, we call this rarefaction. I'm not going to spend much time talking about rarefaction, but I will be talking about its cousin, or its sister, if you will, and this is capillary regression. And it may sound like that I'm mincing words here, but actually these two terms have very different meaning, and we should keep track of that when we use it in the literature. But it's easy to sort of flip between the two and not realize it. From a definition point of view, rarefaction is to make rare or to lose something, whereas regression is to return to a former state. And so rarefaction really applies to disease. It could apply to aging. There's some data that shows that we start to lose our normal vascular network, and a rarefied network rarely comes back to its former state. So this is something that often is permanent, but I don't know that we can say that conclusively. Whereas regression is something that can really move back and forth. And we certainly see this in the context of menses, where many studies have been done, and the cycle that goes through with proliferation of blood vessels and then regression. And then we can see this in the context of exercise. And so I'll present some data that we've done with exercise, training obviously being the expansion phase, and the detraining being the regression phase that we want to look at. So my 2 slides regarding the training, the initiation part. First of all, I became interested in the negative angiogenic regulator response, thrombospondin, because of work that we were doing in San Diego at the time. The image that you see right here is Tim Gavin's work showing 5 days of acute exercise. So this is 1 day, 2 days, 3 days, looking at the VEGF response. A single bout of exercise with 1 day of exercise has this predictive 3 to 4-fold increase in VEGF, and with 2 days of exercise, there was a slight drop, but essentially this remained above baseline. Some time after Tim had finished and published the study, I got the idea to say, well, if hypoxia is the underlying stimulus, as many of us believed or were studying at that time, still true, but we certainly know that hypoxia is not the only stimulus. Anything that would be stimulated by hypoxia, in theory, should go up with acute exercise, because that was the prevailing thought in the lab and what we were trying to prove at the time. And so I found a list of other genes that were hypoxia-mediated that could potentially be related to angiogenesis, thrombospondin being one of them. And so I took the same samples that Tim had stored in the freezer. I didn't know if this was going to work. Ran a northern blot for TSP. And I was surprised to find that TSP, which is a negative angiogenic regulator, inhibits angiogenesis, was also increased with that acute bout of exercise. And it wasn't until we saw these data points that it actually started to make sense. And although it was increased by 3 days of training or exercise, the TSP response was no longer increased and essentially had fallen back to baseline. So as soon as I saw this, I realized, well, this is exactly why I can't go and run around this building or do one bout of exercise, upregulate all my pro-angiogenic regulators, and now I should have more capillaries, right? Well, that doesn't happen because one day isn't sufficient. And part of the reason is because even though you've increased VEGF, you're also increasing the negative angiogenic regulator. So it takes multiple days of exercise in order to get adaptation. And then I'm just showing some data that we did later on to give you some background for the detraining slides that are coming up. If we give a mouse a treadmill, this is supposed to be a video, but I didn't bring it. It's kind of fun to watch these guys. They run incessantly if you give them a wheel. If you try and do treadmill training, it's very laborious. You can only get them to do about 1/4 of the amount of actual work that they do with treadmill training. And it takes about 6 to 10 weeks in order to get skeletal muscle adaptation, at least with capillaries, if you do treadmill training. If you give them a running wheel, you can actually get increases in capillary. People have shown as early as 5 days. In our work, we see increases in capillary fiber ratio by 7 days, and then it increases further by 14 and by 28. And so this helped to sort of establish the foundation for the detraining work that we were going to do in terms of how long of the training regime we would do. And we've gone on to publish a number of papers, and it's not just us. There's other groups, and in fact, we've collaborated with Tara and Olivier and Emily, and Ellen's been a huge part of this. So this is by no means an exhaustive list of papers establishing the importance of the 2 genes that I'm going to focus on today, and that's VEGF and thrombospondin. So even though those are the genes that I'm going to focus on, I don't want any of you to leave this thinking, A, that those are the only ones that are important. There's a whole connection of genes that we have to think about and that play into this. This is a coordinated response. But from knockout studies, from pharmacologic intervention studies, we have established that in the absence of these 2 genes, we have significant impairment in the ability of animals to adapt to exercise. And so the take-home message from this first part with training that I just want everyone to be, and I know I'm talking to the choir in some respects, with some people in the audience here, but just to make sure we're all on the same page, under a homeostatic resting condition, we don't have changes in our capillary network. Our body has adapted and built the network that we need, so we're completely fine. With acute exercise, we found that you stimulate both the activators and the inhibitors, and so you don't get adaptation. You haven't really disturbed, even though there's been a metabolic response, you're not going to get adaptation. And it's only with chronic exercise that what happens is you really don't change the inhibitors. You have more, well, you do change the inhibitors, but they eventually come back down to baseline, and the activators stay elevated, and so we get this, we get capillary formation. And so in the context of trying to understand how vessels grow, why they don't grow, why they regress and change in the context of disease, we began to, this collaboration, there was a collaboration that I started with, oh, I keep pressing the wrong button here, sorry with Fabio Esposito, who is professor in University of Milan. He was in San Diego for a while. And he came up with an idea for one of his students, and Mo Malik, who was a postdoc at UCSD at the time, to look at detraining responses. And so we did this study, and I'm just going to show you a couple pieces of data from that slide, or from the paper. If you look at the plantaris muscle and the soleus muscle, these are capillary fiber ratio, untrained animals, trained animals. These were rats. They were trained on a treadmill, so we did 10 weeks of treadmill running. And then the animals were detrained for another group was detrained for 7 days. For the soleus, capillarity came back to baseline within that 7-day window. So 10 days of effort here, 7 days you've lost it. With the plantaris muscle, we see that there's a partial reduction, but not quite all the way back down to baseline. If we look at VEGF protein concentration, we did two things here. So we had these groups, but within these groups, we had two subgroups. We had a group that we would look at a basal response, and a group that we would acutely exercise and look at the acute exercise response under each of these conditions. And so you can see that in the untrained, the controlled animals, acute bout of exercise increases VEGF. Nothing novel there. Many people have shown that before. With training, this is an issue that Ellen and both Emily just talked about. We lose this response in the trained animals where you have more capillaries. You no longer get that stimulation of VEGF. You have an advanced capillary network. It's expanded. And so in either the soleus or the plantaris, you've lost that. So again, nothing new. This is well established in the literature. What was new then was this detraining group that had been trained the same protocol as these guys, but then detrained for 7 days. And here's where we saw something really interesting that at first I dismissed as just a spurious finding. And that is, one of the things we saw is, so we see this partial reduction here, but look at the basal levels of VEGF. This was elevated. So we had a condition here where VEGF is higher than the untrained control, but yet capillaries are going down. So as I said, seemed to be a spurious finding. I just sort of dismissed that as, okay, this is just random chance that we found this weird thing. We didn't really see it in the soleus there, so no big deal. Keep moving on. We did see restoration here in rats of, or not quite restoration, but some return of the increase here. This is only about a twofold increase, whereas this is 3 to 4. Same thing in the soleus. Mo Malik by now had moved on to Wayne State. He had started his own lab, and he did this study with this flavonoid substance that he was interested in, and it also included a training group and a detraining group. And I'm not going to get into the findings with this flavonoid. What was really interesting out of this is if you looked at the capillary fiber ratio again, untrained animals, trained, of course this goes up. Detraining now is 14 days, capillaries come down. Look at the VEGF response. This is VEGF protein levels done with Western blot. And training, there was no real change in VEGF protein. But now again, we see elevated basal levels of VEGF in a condition when we have a regression and loss of capillaries in a muscle. Again, not what we would expect. In this study, Mo actually also did thrombospondin, and in this case, with the trained animals, where we saw the elevated capillarities, we see that thrombospondin is down, and then when it came to detraining, thrombospondin is back up. So thrombospondin has increased from the trained state to the detraining state. So we decided, I wanted to get a better handle and see, is this real with what we're seeing with VEGF condition, and get a better handle on the time course response of some of these factors in response to detraining. So we did a protocol, 21 days of wheel running, and then animals were studied at day 1, which is basically our train control because we wouldn't expect any loss of adaptation 1 day after training. 7 days, 14 days, and 28 days. All these groups had pre-max exercise testing, post-max exercise testing, and then at their assigned group, and so I'll just go through some of this data really quickly. This is just what I showed you previously. We chose the 21 days of training because it fit nicely within this window here. 21 days rather than 28 because that's one less week of us having to do that. We're still getting a very strong angiogenic response. I didn't want to go with 14 days just because it was a little bit lower. So anyways, we got a nice, good 21 response from 21 days of training with capillarity. And then we see now that we get 21 days worth of effort lost after 7 days and pretty much back down to baseline across this time course. And I'm not expecting you to really read this slide. I'm just going to highlight that we did this. We looked at the gastroc, the plantaris, and the soleus. And in all cases, we found that our D1, our detrained for 1 day, our trained controlled animals had increases in capillarity. And all these were the actual numbers associated with the one slide that you saw there. But we saw this across multiple muscle groups. So soleus, which is predominantly a red muscle, the plantaris, which is mixed but skews towards the glycolytic, and then the gastroc, which is a mixed muscle. And if we look at the performance with maximal running velocity, maximal running speed test, obviously a range. This is not uncommon in mice and rats, but all the animals that underwent training actually had an increase. The red dot here is the untrained animals, so obviously there was no post-training, but you can see they all fell within the same range. So measuring it as their own controls, there was a significant increase with training for the animals that underwent training, and with all the detraining time points, it returned back down. This stops right here because this is the animal that was studied at D1, so our trained control. And again, just to reiterate, this is a figure from a review that Olivier and I authored, and we realized that there are a wide range of pro and anti-angiogenic factors, and many of these must work in concert. But in the papers that I report, we've looked at matrix metalloproteases, MMP2, MMP9. We've looked at endostatin. We've looked at a number of these. Today I'm only going to talk about VEGF and thrombospondin, in part because of the time that we have. So if we take that detraining study and we look at VEGF, we look at thrombospondin, I'll start off with the gastroc and then I'll fill this in with the other muscles. And then just for reference, this is our capillarity data. So everything in this pink box is returning back down to normal, so you can see we have our increase by day 1 here. So day 1, we have elevated VEGF in the gastroc muscle, we have elevated capillarity. Makes sense, nothing new there. D7, we see that there is return of capillary back to baseline. There's an elevated levels of thrombospondin, and these are all VEGF, or these are all protein expression levels. Again, we see this at the D7 time point, we still have and maintained an elevated VEGF. VEGF is going up. It stimulates angiogenesis, yet vessels have regressed. We've lost vessels. This is completely counter to what anyone expects or anyone thinks in the field. But it's now the third time that we've seen a situation like this. And if we look at this in the context of these other muscles, we're seeing the exact same thing across the muscles. So this isn't just one muscle group. This is all the muscles we looked at, which was from the hind limbs, so the triceps seri here. And so the take-home message that we got from that was that when we talk about regression is not merely the reversal of what we had to do or what the muscle had to do to develop the capillary network. And so you actually increase negative angiogenic regulators, thrombospondin being one of them, but not the only one. And there's actually minimal influence. This regression is occurring in the presence of elevated VEGF and elevated stimulators. And to me, that's a very important concept to understand, because it tells us that the analogy that I use for the students in the lab is the gas pedal and a brake on a car. You can drive a car, you drive a car with a gas pedal and you accelerate to go forward, and if you let off on the accelerator, the car will slow down. You will slow, but if you need to stop at the stop sign, you can't just use the accelerator. If you need to have precise control, you have to have a brake. So you have to have another mechanism to actually reverse or change and stop that process. And so I think that's what we're seeing with angiogenesis here, is that we have a acceleration and expansion part, and then we have a separate mechanism. And it's not that they're completely divorced, because obviously you use the gas pedal and the brake in a car simultaneously to have the best control of the vehicle. Because if you only had one of those, it doesn't work as well, doesn't function as well. And so I think that's what we're seeing biologically as well. And some evidence from, since I knew Emily was speaking here, I want to shout out to some of the collaborations that we've done, and we've also collaborated with Tara on other projects and other ways to stimulate angiogenesis and test these ideas. But in the interest of time, I'm just going to show this work from Emily. In the soleus muscle here, so Soleus and Olivier and Tara had this idea, well, let's start really comparing the VEGF to TSP ratio in response to capillarization. And so if you look at the soleus muscle here, you can see, actually let's focus on this panel down here. The gray area correspond to capillarity, and you can see with hind limb unloading, number of days, you get loss of capillaries. This is a normal response. And if you look at now the ratio of VEGF to TSP right here, you can see this mirrors this very nicely. You're losing capillaries with increasing hind limb unloading, and the VEGF to TSP ratio decreases. If you look in the plantaris muscle, you can see you really didn't have a change in capillarization. We also didn't see a significant change in they didn't see a significant change in the VEGF TSP ratio. So just one piece of data that sort of supports that idea. Now, the second part of what we did with the detraining study was we had animals, what I've showed you was the basal responses, but we also had animals at each of these time points perform an acute bout of exercise so we could test that effect, that angiogenic effect or stimulus following each of these time points. Before I show you that data, I need to just remind you, or, well, not remind you, let you know that we, based on a previous paper that we had done with training, we realized and we knew that we had to make a choice. And that is, when we looked at the time course, this is in response to an acute bout of exercise now, hours following the bout of exercise, at the protein level, we can see that VEGF and some of these other factors that we were interested in peaked 2 to 4 hours post-exercise. This is a time frame that other people have shown in the literature. Allen's 1996 paper is one of the, I think it was the first paper to sort of establish that timeline. But when we looked at the thrombospondin response, we see that we're not seeing it at the 2 to 4 hour time point. If you look at the gene expression level, thrombospondin does peak 2 to 4 hours at the gene expression, just as VEGF does, but at the protein level, we're not seeing the same thing. It's actually 12, 24 hours, and maybe there's some evidence that it may even be later than that. So what we knew from these acute exercise studies was that if we were going to sacrifice the animals at 2 to 4 hours post the acute exercise bout after their detraining time point, we were not going to capture the thrombospondin side of this story. There was no way that we could. And it creates tremendous amount of problem when we try and do these studies to truly integrate our responses when these factors have different time courses. And so I'm not expecting you to be able to look at the slide. I'm going to zoom in and we'll just focus on 2 of these for VEGF. But this is a summary table that we show the acute responses in the group. So let's just look at the plantaris and the soleus. We're just going to look at VEGF again. And you can see untrained animals, acute exercise increases VEGF in both plantaris and soleus. That's consistent with the existing literature. Our trained animals, we lose that response. They no longer have the elevated response. Again, nothing new there. Now what happens with detraining? Well, we continue, and what surprised me is that even after 28 days in both these muscles, we continue to have loss of the ability of that muscle to stimulate and increase VEGF, even though the capillarity level has come back down to baseline by day 7 in both these muscles, telling us that there's more work for us to do to figure out. In fact, some of the work that Emily is doing and that Ellen has described in the context of epigenetic responses and gene silencing, I think are very interesting and could explain some of the findings that we have here. So I don't have an explanation for why this takes so long, at least in our studies, why it's taken so long, and those are areas that are open for active investigation. And so the take-home message now is, first of all, the temporal response for regression seems to be faster than what it takes for us to create the capillaries. And then we've talked about this already. It requires negative angiogenic regulators to actually initiate, not simply the reversal of VEGF. And in fact, we find that you have elevated VEGF when capillaries are going down. So clearly, the regression is not related to VEGF because you wouldn't predict or expect that response. And that following regression, the responsiveness of VEGF and potentially other angiogenic regulators remain blunted for a period of time, and we don't know how long that is based on the current studies that we've done. But at some point, presumably, they must come back and return to the basal levels. And there is some evidence that, as I showed with hind limb unloading, but there are other studies I don't have time to show you related to diabetes, metabolic syndrome, that might also support the fact that these same pathways that we're seeing with regression may also be involved with rarefaction conditions that occur. And so with training, you've seen this slide. Acute exercise increases both positive and negative. Chronic exercise, the negative return back to baseline, causing the positives to have their effect. When we looked at detraining, you're at some homeostatic state after the training. You have two options. You can either remove the stimulators, remove VEGF, and tilt the balance this way, or you can have more negative angiogenic regulators. And with the data that I showed you, I hope I've convinced you that this is not the pathway that actually occurs, at least based on the data that we have seen thus far. What happens is you stimulate the negative regulators, and this may even be elevated to some degree based on this balance, but it's going to be the increase in thrombospondin that's actually going to drive capillary, or the negative regulators that will drive capillary regression. The clinical implications for this, I think, are actually fairly significant, because if we look at the long list of everything down here relates to excessive angiogenesis. Everything up here relates to conditions involving where you lose capillaries and you get rarefaction. And particularly in the context of cancer, Avastin has been wildly unsuccessful. So you have someone who has cancer who has this abnormal hyperproliferation of blood vessels, and so you give them a VEGF blocker, and it does nothing. The tumors don't regress, and there's very few tumors that have actually been responsive to Avastin. And in fact, when Avastin is given early, before the vessels develop angiogenesis, it does work, saying that if you inhibit VEGF, you can't grow vessels. A lot of the work that has come out of San Diego from my work, from Ellen's work, and others show that VEGF is required for angiogenesis. But once you have those vessels, you can't simply withdraw VEGF from the system and expect that network to go away. Our detraining data really, I think, established that if you want that to happen, you have to trigger and stimulate the negative regulators to actually cause capillary regression, and perhaps this may also explain some of the rarefaction that we see. So much of this work, I have a whole new crew. Most of these people, none of these people are actually in my lab right now, but these are the people who actually did the work that were on the slides. And obviously, thank you for the funding support that we got from our supporters.
Okay, thank you, Mark. One quick question. In terms of the loss of capillaries that you see by 7 days post-training, I mean, that seems remarkable to me that you can get such a deconstruction of these new vessels. Do you think that, have you seen any evidence that the endothelial cells are dying off, or do you think that it's more like they're getting drawn into other capillaries, like has been shown in embryonic remodeling of vessels?
Yeah, so we really haven't explored that end of it, other than to characterize what's happening at a growth level. So, you know, that is still work that, and obviously there was more than 2 people in this room that had that question. So yeah, that area is unexplored. So I don't have the answer for that, but it's a great question.
Okay, well, thanks to all the presenters again, and to the audience for sticking with us through all of this session. Enjoy the rest of your day.